I'm Dr. Brooks Ficke. I'm a hand surgeon with Resurgence Orthopedics, and I work at the St. Joseph's, Roswell, and Cumming offices. Trigger finger is a tendon problem that causes the finger to click back and forth when you try to make a fist. The tendons that control the tip of the finger, the muscles in the forearm, and they run down the arm, and the tendon comes all the way out to the tip of the finger, and right in the palm it enters a sheath that holds it close to the bone. And you can think of this like a string that's running through a buttonhole that's just a little bit too small. The individual fibers of the string bunch up and form a little knot or nodule, and that nodule is what clicks back and forth under the edge of the tendon sheath when you make a fist and straighten back out. Trigger finger usually presents with pain in the hand, right around this area, usually right around the creases, and clicking. Sometimes it's subtle, sometimes it's just a little rubbing, sometimes the finger gets all the way locked down and you have to pop it out with your other hand. Oftentimes the pain in locking is worse at night. Sometimes people say they wake up with it stuck down and they have to pop it out, and then they get moving for the day and it does okay. But sometimes it also happens all throughout the day. The very first time someone has trigger finger, we usually try to treat it without surgery. That can involve a splint, which usually a person wears only at night and only if they're having pain at night, and a steroid shot. Steroid shots go into the palm and are pretty good, but not perfect at curing trigger finger. If 1 or 2 steroid shots don't cure it, then we can talk about other things like a percutaneous release, which is using a needle to cut that sheath, or a surgery. Surgeries can be done in the operating room, either with the patient awake under just local anesthesia or with some sedation, depending on patient preference.